Here we go into the lower quarter. So now we're starting to enter into the pre-phase of getting into a movement pattern test, where you're going to start using everything that we've been building up on so far. So we're going to break up each joint in terms of we're looking at the hip, the knee, then the foot and the ankle before we get into gait and the movement pattern tests. So just a couple of highlights. Again, I encourage you to follow along with your workbook, so you're taking notes in your workbook, but also to take some time to read the workbook before and after these lectures, so everything can kind of gel and start with that repetition to really make sense and to sink in. So just a couple of hip basics, nothing that you don't already know. The ilium, ischium, and pubis together is what we will call the innominate bone. If we separate them, it's for purposes of perhaps muscle attachments or for bony landmarks in this particular class. And what's important to note here is that the deep acetabulum that you have in this particular joint with its strong ligaments and muscles is really what helps to create this beautiful suction type of stability that is created at the hip joint. It is incredibly difficult to dislocate the hip for that reason. But that's important because it's a weight-bearing joint as well as a joint that has an extreme amount of range in terms of it moves in all planes as well as has that circumduction. Right? So keep in mind that, and the reason why it's so important for you to have these functional anatomy charts looking at muscles as groups that contribute to a movement versus singular muscles is, and when you do that with your anatomy book so you can see the fibers that those muscles run. Why is that important? Because as soon as the joint moves out of this neutral position that we seem to like to memorize when we look at anatomy books or when we look at posture, we think people are just stagnant in this neutral position. But that's not how we live life, right? We move constantly. So as soon as that joint comes out of that neutral position, well, guess what? Those muscle fibers, every single muscle that is attached to that joint or those bones that are moving, their length has now changed. Therefore, their torque and their potential for force has changed. So, understanding muscle fiber direction, the line of pull, in terms of origin and insertion, not just memorizing origin and insertion, but when one pulls towards the other and vice versa, understanding which directions those are in is a great foundation and knowledge for you to have as you move forward in terms of having a career with movement and movement of the body. They are all implicated when movement starts to happen. This is just a really great visual if you'd like to look at them as separate pieces before you look at them all together in terms of looking at each pelvis. Please note that they do move separately, right? Right in the center, there is a pubis symphysis that gives you a certain degree of motion that separates one pelvis from the other, one innominate bone from the other, which is extremely important. So this picture is really good only because it highlights some of these ligaments, and I like pointing it out only because these ligaments themselves have this torsional structure to them that is really important, because when you move into flexion, extension, rotation, these ligaments that help create that stability at the hip, they're kind of like wound up, and then as you move, it'll unwind, it'll tighten the opposing part of the ligament or an opposing group of ligaments to still stabilize you, but now this one gives you a little bit of lax so you can get that range. And so having a visual representation of what's actually happening at the joint helps you appreciate when somebody complains of pain or discomfort in certain motions, where that might be coming from, where something might be getting caught, or where something might not be moving as fluid. In terms of the acetabulum there, the bigger picture just gives you a nice little picture of the labrum and the inside of the joint where that hip joint is rotating and spinning around. I'm really big on visuals, as you guys have noticed by now. So bony landmarks that will be important for this class in particular and moving forward as well. When you are looking anteriorly, the ASIS, the anterior superior iliac spine, you can call it just the ASIS, and it's pointed out here in this picture, is an important bony landmark because it will be what we will use to help our athletes find certain muscles. It will also be helpful for us to kind of visualize that to see if one is elevated versus the other one. But it's a great landmark for us to use in terms of certain muscles that we will be training our athletes to learn how to activate. On the posterior side, we have the PSIS, the posterior superior iliac spine. And that more so for therapists is a bony landmark that we use so we can compare if there's some rotation going on in the pelvis in one side versus the other. But it's also a great just postural point for us to see how they're lined up. Greater trochanter is great because we will be discussing bursitis, and sometimes that is a location of trochanteric bursitis that is very common. Iliac crest is important because now we have posturally, we can easily find the iliac crest and see if there's one that is elevated versus the other. So it's a great visual point for us to focus in on when we're looking at people's pelvis and hip region. And then the pubis symphysis is not a bony landmark that you will visually see, but it's important to keep in mind because that's where the rotation happens at the pelvis. So two things that we're going to point out. We're going to point out angle of inclination, and then we're going to look at femoral torsion. So these are a couple of changes that happen within the femur and as it relates to the femur and the neck and the shaft in different planes because it will have implications for posture. Much more details are in your workbook again. So the angle of inclination here, this is a frontal plane angle description. Again, it's frontal plane. So it's moving in this plane, frontal plane. And it's between the femoral neck and the medial side of that femoral shaft. Okay, whichever one of these pictures helps you understand it best, I like to give several visual representations of what I'm talking about because some gel better with people than others. So the normal angle by the time we are matured in this joint is around 125 degrees. So if you're looking at the picture that is right underneath the title angle of inclination, right? The one in the middle is the normal. That's around 125 degrees. Okay, so when we have variations of this inclination, it's called either coxa vara, which is less than 125 degrees, or coxa valga, which is greater than 125 degrees. And the reason why I bring this up is because these variations are something that will be related to, and you will note in hip biomechanics that can lead to hip degeneration, but it will be noted in somebody's posture, specifically the knee angle. So now we're starting to correlate that knee valgum and varum that we learned about in the posture and how that might be related to what's happening at the hip. So for example, coxa vara will be related to genu valgum with a G. Okay, so coxa vara, if you remember, it's less than 125 degrees, and it will then angle that shaft of the femur inward. It will angle it medially. So it will lend the posture in the frontal plane of that knee to genu valgum. Now the opposite is true. If we have coxa valga, which is greater than 125 degrees, right? Now it brings that shaft laterally and it will lend our posture, especially at the knee in the frontal plane, to genu varum. Okay, make sure you understand how those two relate to each other in the frontal plane. Now we have torsion. When you think of torsion, you should think rotation. So the proximal femur shape and its impact on posture and movement, femoral torsion has an implication in the transverse plane. Okay, so now we're looking at rotational implications. Now the normal angle, if you're looking at the picture, it's the top left picture. The normal angle is around 100 and, not 100, I'm sorry. It's around 15 degrees. Okay, so that's around 15 degrees, and you can see that on the picture. And when it's 15 degrees approximately, it's called normal antiversion. Okay, because there is a little bit of antiversion there. It's not parallel, it's about 15 degrees. So that is what provides optimal alignment. And how will you see this represented in posture? Remember, those patellas I told you are going to give you clues to what's happening at the hip. So here's a perfect example. When you have that optimal alignment of normal antiversion of 15 degrees, your patellas will be facing forward. Okay? So now, the next one is excessive antiversion. That's the picture of the top right. That is when we have greater than 15 degrees. Okay? Now the bottom left, right? The bottom left, yes. The bottom left is less than the ideal 15 degrees, and now it's called retroversion. Okay, so we have normal antiversion, we have excessive antiversion, which is greater than 15 degrees, and then we have retroversion, which is the less than 15 degrees. So this, of course, has an implication on posture, but this time we're implicating posture, or we're having an impact on posture in the transverse plane, and we're going to see it more so in the feet. Okay, so excessive antiversion, you're going to see that sometimes as in-toeing. And I say sometimes because sometimes people have compensated in torsioning another part of their leg in order to avoid that in-toeing. Okay, so in-toeing is related to that excessive antiversion. And if I'm in-toeing, what's possibly happening at my hip? I'm also internally rotating. So I have a larger hip internal rotation. Okay, so if we go one way, we have to be able to go in the opposite direction. So retroversion, less than the ideal 15 degrees, is related to a toeing out. Think of a ballerina stance, right? A lot of times the ballerina stance try to get that 180 degrees. So this toeing out then is also related to external and a larger external rotation happening at the hip. This is what a lot of ballerinas wish they had structurally impaired, so to speak, because it gives them that larger toeing out or external rotation for that first position that they want to get in ballet. Okay, so in terms of arthrology, the joint, you know it's multi-axial. We're moving in several planes here. It's a very stable joint. I already explained that to you earlier. In terms of the hip motions, know the planes that we're moving in. Flexion and extension, sagittal plane. Abduction, adduction, frontal plane, right? External and internal rotation, that's happening in the transverse plane. You want to know those basics. But what I want you guys to know, and it's in your workbook in terms of some more specifics, know approximately how many degrees can they or are we supposed to be able to get in each one of these movements. Now, why does that matter? Well, because if you are assessing somebody's movement, and they're demonstrating limitations in range or excessive range, but you won't be able to know that because you don't know what the normal range parameters are. So understand what is approximately a normal range for each motion so that when somebody demonstrates something outside of that, then you can pinpoint something is going on here. I need to focus in a little bit on that. For example, flexion is around 125 degrees. Extension of the hip is really only about 10 to 12 degrees. So if they're getting more than that, they're probably getting it from their low back or they're getting it from somewhere else, right? So kind of have a look at that in the workbook. Abduction, 45 degrees. Internal, external rotation, approximately 45, 50 degrees. Know the ranges so you can spot when something is not within a normal range. So stability for mobility, I really will not spend any time on this because we've gone over anterior and posterior pelvic tilt several times already by now. But there is a summary, a recap in your workbook under the hip section, just to kind of bring it into this category in terms of understanding how to use your functional anatomy charts and understanding force couples that directly have an implication on the pelvis, because that also will then impact the movements at the hip. So understanding these muscle interactions are very important, and what the force couples are that create some of these movements. Now, the common injuries that I put into this particular section, as you know, there are many that can happen at the hip. I chose labral tears, hamstring strain, and bursitis as descriptions of the injuries and what type of symptoms your athletes might present with very briefly in the workbook, because these are likely related, many times related to repetitive movements done by athletes and performers, such as hip flexion, or they are related to muscle imbalances that we will be able to address with corrective exercises, such as hamstring strains and bursitis. Many times are caused by muscle imbalances and movement impairments. So understanding some of the mechanisms of injury, not all of them, but some of the mechanisms of injury and how they may complain of the issues, you can start to think of which movement assessment will likely confirm your hypothesis of what movement impairment or muscle imbalances might be going on. So then you can start addressing the issues that are causing it with the proper corrective exercises. So now we're starting to link your functional anatomy, your observational skills in the posture, and all of those movements that you will be assessing. But now just knowing a couple of the injuries, knowing why, um, understanding how injuries take place in order to link it to causation is something you will start to learn in this class. I don't pretend to give you guys all of the injuries that happen at each one of these joints. It's just to start getting you thinking in terms of how can we prevent injuries and what injuries specifically can we discuss in order to practice some of these skills that you guys are learning.